Bismillahirrahmanirrahim. Assalamu alaikum. This is me, Nadia Rajput from DesiTVUSA. Let's have a look at the special report. Houston Community Media hosts Forum on Housing Crisis and Climate Challenges. A special community forum titled Mapping the Housing Crisis in Houston was organized by Houston Community Media in collaboration with American Community Media at the Southern News Group headquarters 11122 Valley Boulevard, Houston, Texas. The meeting brought together policy experts, housing advocates, and nonprofit leaders to discuss the growing challenges of housing affordability, rent increases, and the impact of climate change on public health and financial stability in the Houston and Harris County area. The forum was opened by Sandy Close, founder of American Community Media, who emphasized the urgent need to address the housing and climate crisis through informed community dialogue and collaborative media efforts. The event featured distinguished speakers from leading organizations working across housing development and homelessness service in Houston. Cheong, Associate Director, Center for Housing and Neighborhoods at the Kinder Institute for Urban Research, presented an overview of Houston's housing trends and the widening affordability gap. Nancy Rojas, Senior Program Manager, Single Family Housing Development at Harris County Housing and Community Development, discussed ongoing efforts to expand access to affordable housing for working families. Catherine Villarreal, Vice President of Public Affairs Coalition for the Homeless, Houston, highlighted community-based initiatives to reduce homelessness and promote sustainable housing solutions. Carlie Brown, Chief Executive Officer, Healthcare for the Homeless, Houston, spoke about the health impacts of housing insecurity and how climate change is intensifying vulnerabilities for low-income populations. Each presentation was followed by a question and answer session, encouraging participants to exchange ideas and explore potential solutions to Houston's housing crisis. Key issues discussed including the rising cost of rent, affordability of home ownership, rapid suburban growth, and the intersection of climate change with housing and health outcomes. The forum concluded with a networking luncheon, providing an opportunity for attendees to connect with housing professionals, media representatives, and community advocates. Lunch was created by Phoenicia Specialty Foods. The event served as an important platform to foster collaboration and raise awareness about the urgent need for equitable, climate resilient, and affordable housing across the Houston region.
We are so fortunate to have a really strong panel of speakers for this first of two briefings. We realized housing was so complex, we couldn't do justice to it in a single briefing. So today's briefing will kind of map the landscape of what's happening with housing in Houston. And the follow-up briefing in January will look at ways people are finding to get housed and stay housed. It will be more solutions-oriented. We're really grateful to the kids
there. And PM 2.5 is particularly dangerous for cardiovascular health. So in terms of how people are actually reaching out for help after a disaster, we found that after Hurricane Beryl and the derecho, that there was a concentration of valid FEMA applications and 311 calls in specific areas. But what we found is that it wasn't necessarily the damage that inspired people to call, but a neighborhood's poverty rate, which had a stronger association with the number of FEMA claims. And that's perhaps not surprising, right? That these particular neighborhoods, they need the most help. So what we did then is that we created a composite score of 4 indicators of housing quality. And what we found basically is that there is no such thing as a natural disaster. And basically what that means is that the negative effects of climate change and extreme climate, they intersect with these pre-existing social and economic inequities across class and race. And these are...
Good morning, everyone. My name is Rojas. I am the Senior Program Manager over at the Harris County Housing and Community Development Department, specifically in the Single Family Housing Department. So our department mainly focuses on creating, preserving, and also assisting in the homeownership restoration for families, vulnerable families in Harris County. So we have made a lot of investments in the community, and we have taken a lot of data from the Kinder Institute to make, smart investments in developable areas outside of hazard areas as well. So we have invested $124 million to assist a minimum of 1,417 households, and this is across a range of products. So we have, of course, a preservation bucket, we have reconstruction of single-family homes, as well as rehabilitation of single-family homes in-house, and we also partner with nonprofits and the community to also extend that rehabilitation service to families. At this time, we have a goal of 88 houses to be rehabbed. This is a minimum, of course it could be more. On the creation bucket, we have a lot of programs on the home buying side. We have the single-family reconstruction program, which I will be sending a couple flyers to you guys. It's a great opportunities for families who qualify for home buying programs. We also have down payment assistance programs, as well as the Harris County Community Land Trust. We are making a lot of investments, as I said, that are data driven. So we have 2 communities coming up in the single family construction program in the 1960 and LF Boulevard Spring area, as well as Vista Road in Pasadena. Orchard Place is in Providence Place. We're building 54 townhomes. They're in the ranges of $260,000 with a sales price reduction of up to 45%. So this is a great opportunity for families making below the 80% AMI of the Harris County income. And we also have Providence Gardens, as I mentioned. It's a 60 mixed style home community in the spring area. Same qualifications. Please help us in reaching out to the community and sharing these programs. As far as the Harris County...
And now for our media colleagues.
Hello everyone, my name is Shanice Flex. I'm an online journalist, freelance journalist for my own website, and I also work for the labor unions.
7 apartments that would have been affordable to them. And if we look at households at or below extremely low income, there were only 16 apartments available for every 100 families. So you're already starting to see a picture of, Houston has this reputation of being an affordable place. I think we can see that that's less becoming the case. It's less and less so, and especially if you're at those low income thresholds, there's really not that many apartments available for you that would be considered affordable. Number 5, since 2012, the Partners the Way Home have housed more than 35,000 people experiencing homelessness. So again, we've been really, really focused on housing as a solution to homelessness. And again, every single one of those people we're talking about, they got an apartment with a rental subsidy and a case manager to help support them. 35,000. Yeah, since 2012. So we have, again, this network of dozens of service providers working together under the umbrella of the Way Home and working together. It's been more than 35,000 people. The amount of time that people, our clients, were in their housing kind of depends on, we have different kinds of programs. So some folks, they get a housing subsidy for 12 months until they can find a job, kind of get back on their own 2 feet. And then you have other folks, if they have a disability that can be documented, then they're not necessarily expected to be able to get a job, and so their housing subsidy and case management can go on for longer. Number 6, housing with supportive services solves homelessness. So it sounds kind of obvious, right? If you have somebody who's experiencing homelessness and you put them in an apartment, they are no longer experiencing homelessness. So I don't mean this to sound trite, but this approach has really proven effective. So remember a moment ago I said we have around 3,300 people experiencing homelessness in Houston. That's down about 60% since 2011. So when we counted in 2011, we had more than 8,000 people experiencing homelessness, and now it's down to around 3,300. It's remained stable the last couple of years. but we're worried that that number might
cause housing instability, does housing instability cause mental health instability? And so you really just have to kind of throw that misconception out the window and look at how do we address this in a multifaceted way. Let me go back to my notes. I was asked to talk about the more why do we exist than what we do. So I hope that sets the stage for the why we exist, but a little bit about what we do. So HCH, or Healthcare for the Homeless programs across the country, for a long time have been built and designed to address what are now called non-medical drivers of health or social determinants of health. And I think as we look at some of the shifts that are probably coming down the pipeline in housing funding around HUD, healthcare funding is going to be tapped in new and different ways to try to address homelessness. Particularly around how people are intersecting with our emergency departments and with our hospital systems, and then coming back out onto the streets. And I'll tell you an anecdote that is one example of many. The other day, we had somebody show up at the bus stop across from our main building downtown in a hospital gown with hospital leads still on him, freshly released from the hospital. And I'd like to tell you that that is a one-off experience, but it's not. And when you look at
the patient was released with nowhere to go.
With nowhere to go.
But wearing his hospital gown.
Correct, yes. And actually the number one complaint for our emergency shelter partners are people who are showing up there post-hospitalization with nowhere to go. And so for a long time, our healthcare system has been a little bit insulated in being pushed to address homelessness. And I think now with some of the shifts that are happening on the federal level, healthcare systems are going to be tapped and hospital systems are going to be tapped in new ways to participate in solutions.
I had a question for Ms. Caroline. I want to clarify something that I heard you say. Did you say that there is no such thing as a natural disaster and it's only for poor people?
That's all for now. Keep watching Desi TV USA. Please like, subscribe, share and comment, and don't forget to watch our channels DTV NN and Desi Urdu TV.